It is midday, and Gaudensia Tankobatajira is sitting quietly on a stool beneath the shade of an avocado tree at her home in Kabijemira village, Busiriba sub-county in Kamwenge district. Surrounded by her grandsons, the 63-year-old woman patiently shells beans. At first glance, there is nothing unusual about her. However, beneath the cloth wrapped around her legs lies a disease that has crippled her life. Both her legs, from the knees to the feet, are severely swollen and misshapen. Over the years, the skin has hardened. Her toes too are enlarged. She can barely walk around her compound.
I have been sitting here since morning. This has been my daily routine since 1996. I cannot do my housework because my legs ache and itch. I can barely sleep at night.
She is just one of many residents in this remote community in Busiriba sub-county afflicted by elephantiasis, a disease that causes extreme swelling and thickening of the skin, particularly in the legs. A parasitic worm transmitted by mosquitoes causes elephantiasis, a disabling, neglected tropical disease. In 2002, Uganda launched a program to eliminate elephantiasis as a public health concern. However, in August 2015, an elephantiasis cluster was discovered in Kamwenge district, suffering from a strain called podoconiosis. In Kamwenge, the disease is caused by walking barefoot on irritant volcanic soils. It is associated with disability and social stigma. However, simple interventions such as washing the feet within 2 hours of contact with the soil and wearing protective footwear can prevent the disease. However, these interventions were too late for Tankobatajira, whose struggle began 3 decades ago when she was 28 and pregnant with her second child. Her legs began itching persistently.
Sometimes, when the pain was too much, I would get a fever. Flies would follow me everywhere because my legs smelled. The skin on them turned rough.
For years, Tankobatajira was the only one in her household affected by the disease.
People stopped calling me by my name. They gave me a cruel nickname, Owemirumo, meaning the one with bad legs. It was a painful label, one that brought stigma and discrimination into my life.
It was in 2015 when she attended a meeting organized by a non-government organization that she discovered, to her surprise, that there were other people suffering from the same disease. In Chakatoma village, 45-year-old Enid Twamsima is another victim of elephantiasis. She recalls that in 2000, she noticed the signs of swelling in her legs. The mother of 2 says her mother and brothers also suffered from elephantiasis. All of them have since passed on. Both her legs and hands have been affected.
They tell us that elephantiasis doesn't kill people, but I have already lost my mother and 2 brothers. They all suffered from the disease, and I believe it contributed to their deaths. I'm deeply worried for my children, who are aged 14 and 10. They say their legs hurt when they walk to school. I fear for them. It would be a tragedy if they also got infected.
Last month, an NGO brought her and 3 others to Kampala City for treatment.
We were treated for a week before being referred to Lukunyu Hospital in Kamwenge district. My arm was operated on. The other 2 victims were told that the doctors would return in February next year to treat them.
Twamsima does not believe that elephantiasis is harmless, despite what people say. Although incurable, elephantiasis can be treated and prevented through improving hygiene, surgery, and counseling.
We were told to wash our legs 3 to 5 times a day and avoid direct contact with the soil. The doctors also advised me to elevate my legs when sitting, avoid folding them, and swing them often to help with blood circulation.
In September 2021, Prime Minister Robina Nabanja, accompanied by a team of doctors, visited Busiriba sub-county and donated gumboots, salt, and a small amount of money between 40,000 shillings to 100,000 shillings for upkeep to the victims. Everest Beyanga, a resident of Busiriba sub-county, is the focal person for elephantiasis patients in Kamwenge district. He's a volunteer though. He says the disease was discovered in 2011 in the district.
We got a number of 30 at first, then later more we got 62. We expect to be having now 1,200.
He explains that there was a community's misconception that these people had been bewitched.
We came to know that it is a disease. We called a joint meeting for district and the community until the district wrote to the ministry on this case.
He adds that the disease is more common among women and the youth. In the absence of formal aid, many of the victims like Twamsima have resorted to self-medication. Beyanga adds that, unlike in the past, the disease is now spreading to other sub-counties such as Bigodi, Kababiro, Ramanja and Kahonje. Nabukadneza Mugabe, the chairperson of Lyamugonera village in Kahonje Town Council, has been battling elephantiasis since 2015. At the time he contracted the disease, he was serving as the internal security officer. In 2021, he was dismissed because the disease had incapacitated him.
I can't move far, I can't walk. I'm there seated only.
Mugabe's legs are too swollen to fit in gumboots. In February next year, Mugabe will be one of the victims who will be operated on at Bugema University Hospital.
My children, there is my elder son, one leg has started.
Dr. William Muchunguzi, the district health officer for Kamwenge, declined to be interviewed for this story. He stated that with the 2026 general elections approaching, this story could be politicized, adding that the situation in Busiriba sub-county is calm and in his view, there was no story to report.